Hello and welcome. The content of this video is based on clinical knowledge and clinical material. In this video, we will talk about different types of research that can be conducted in the OBGYN specialty. There are different ways of describing research. One way is to divide them into qualitative and quantitative studies. Another way is to design studies by how the samples are organized. For example, randomization, non-randomization, controlled, double-blind, triple-blind, quasi-experimental, etc., etc., etc. Another way is also to talk about analytical and non-analytical studies. This is not the end of the subject, and there are many other methodologies for describing methods of research. In this video, we are going to talk about different types of research studies that we do in our hospitals and clinic patients in population-based studies. Included in this video are the challenges of conducting research for a clinical doctor. What are the kind of studies that we can conduct in populations, in our clinics and hospital patients? What is the meaning of meta-analysis and how is it presented? There are many challenges of conducting research. We are just going to cover a few of them very, very briefly. So the first challenge of conducting research is to have knowledge and to have experience of epidemiology and biostatistics. And as clinicians who have been taught mostly in clinical subjects and have not done any kind of study on epidemiology or biostatistics during your medical college years, it is indeed very difficult to then have the knowledge as well as the experience for conducting such studies. And for this, it is important to partner with the doctors or with the people who have this kind of knowledge and who have this kind of experience. Time is another constraint, especially for busy clinicians when you are doing a lot of heavy practice, especially in public level hospitals or even in private level hospitals. And because a lot of time is required on reflecting and gathering of information, in discussing and in planning, and then going through the process of documentation as well as of conducting the research. So clinicians don't realize that a lot of resources are required for research. So you require a lot of money to hire staff, to buy equipment, to buy paper, to photocopy material, to distribute material, to have workshops, to train people to do research, and then to monitor the research activities, then to gather the data. So a lot of resources are required for this kind of activity. And so sometimes clinicians are very naive and they don't really know the kind of resources that are involved. And therefore, it's always good to have teams or to work in teams to be able to learn the methodologies. And if you are really interested, then perhaps then you can divide your time so that you spend 1/3 of your time in clinical work and 2/3 of your time in research work. Your colleagues are a very crucial part of being involved in research. And so you have to have people whom you can trust and people who are like-minded or like you, who are enthusiastic and conscious and committed to doing and conducting research and for moving forwards, and also completion of the research work as well as doing publications. A lot of times, if you have not been groomed in ethical issues of clinical work and ethical issues of research, you can perhaps plan some activity which may be highly unethical. And so to be able to conduct research in an ethical manner and to give respect to your patients and to give respect to the whole process of research, you need to have colleagues with you who understand this part of the research planning and research conduct. So ethical issues are an extremely critical and important part of research activities, And if you plan to do publications, then if you have not got clearance from ethical agencies or ethical departmental sections, and if you don't document this in your publication, then your research can never be published. Moving on, let's talk about population-based research studies. So there are many types of epidemiological studies that physicians can perform in populations to evaluate the risk factors and health outcomes of different diseases. Some of the different types of epidemiological studies include cohort studies. These studies follow a group of individuals, which is called a cohort, over time to compare the incidence of disease in those with a particular risk factor to those without the risk factor. And so you can plan a cohort study either prospectively, and you can gather a group of people who will become your cohort and then follow them over a period of time, or you can do a retrospective cohort study in which you have a group of individuals and you have data on these groups of individuals, and you know that they have been exposed to some risk factor, and then you want to look back into their past records to collect information on their exposures and their outcomes. So this type of design can be very useful, especially when if you are studying rare diseases or outcomes that take a long time to develop, as it allows researchers to examine historical data. So cohort studies are particularly useful for investigating the natural history of diseases, determining risk factors, and studying the incidence or prevalence of outcomes over time. By comparing the rates of outcome occurrence between exposed and unexposed groups within the cohort, researchers can assess the association between exposures and outcomes and calculate measures such as relative risk or hazard ratios. However, cohort studies have some limitations. They can be expensive and time-consuming, requiring long-term follow-up to capture the development of outcomes. Additionally, there may be loss to follow-up, which can induce the bias as well as affect the validity of the study results. Moreover, confounding factors need to be carefully accounted for through study design or statistical techniques to ensure accurate estimation of the exposure-outcome relationship. So to be able to factor in all these things into your study design, your study plan, and your study monitoring, you need to have people in your team who have the expertise to be able to do these activities, because clinicians may not have these expertise at hand. Overall, cohort studies are valuable tools for investigating the relationship between exposure and outcomes in a real-world setting, providing important evidence for public health and medical research. This is an example of a cohort study in which the effect of diabetes on offspring has been studied over a long period of time. So this is a population-based cohort study, and it also looks at, so not only does it look at the effect of the long-term effects of maternal diabetes on the offspring, it follows up these children to find out how many of them will develop metabolic disorders and adverse obstetric outcomes over time. So as they are growing up, they are children, and even as young adults. So like you can imagine that this study would take about 20 years maybe, or 30 years to complete. So by different ways you can find out who are the patients, and then you collect the data, then you follow up, and the offspring are followed up over several years after birth with regular assessments of anthropometric measurements, which means weight, height, etc., laboratory testing, and clinical examination. So data on the development of metabolic disorders, cardiovascular diseases, and other relevant outcomes are recorded. Statistical analysis is concerned. Data privacy and confidentiality should be assured and ensured, and patients should be able to give informed consent. And you may get some valuable results from this study. Another method for conducting population-based research is to measure the prevalence of a disease and risk factors at one point in time in a defined population. So as you can see, the time reference is very critical in designing research, in conducting research, as well as in reporting research. So this is an example of a study, a cross-sectional study done in OBGYN. And this is just an example without any data or anything like that in it. So this study aimed to determine the prevalence of maternal smoking during pregnancy among a specific population of pregnant women and investigated its outcome with the adverse birth outcomes. So a random sample of pregnant patients was taken as they were attending the prenatal visits, and it was seen how many cigarettes they were smoking, etc., and what was their birth outcome in terms of gestational age, birth weight, APGAR scores, congenital anomalies, etc. So now we move on to another type of research study, which is known as a case control study. These studies identify a group of individuals with a disease and a control group without the disease. The study compares the prevalence of a particular exposure or risk factors between the cases and the controls. This is an example of a case control study in an OBGYN environment. And this population-based case control study aimed to investigate the association between maternal antidepressant use during pregnancy and the risk of congenital heart defects in offsprings. So now these are individual cases that have been taken, and the outcome in different cases has been studied. The results will present the association between the maternal antidepressant used during pregnancy and the risk of congenital heart defects in offsprings. It quantifies the magnitude of the association, taking into account potential confounding factors. The results can inform clinical practice, prenatal care guidelines, and discussions between healthcare providers and pregnant women regarding the use of antidepressants during pregnancy. So ecological studies are not very commonly done studies, and they study the exposure of environment and its association with disease outcome in a population. An example of this may be the impact of maternal healthcare access on perinatal outcome, a population-based study. So very special statistical tools are used here called ecological regression analysis, and this will adjust for confounding factors and determine the results. And the results will then present the ecological association between maternal health care access indicators, example, healthcare resource availability, prenatal care utilization, and perinatal outcomes. These findings can guide healthcare planning, resource allocation, and policy interventions aimed at improving maternal and infant health outcomes at a population level. We can even use intervention trials in population-based studies, And these studies evaluate the effectiveness of a new treatment or intervention in preventing or reducing the risk of a particular disease. So this is an example of an intervention-based study performed at a population level. And the title of the study is Effectiveness of a Prenatal Education Program on Maternal Health Knowledge and Birth Preparedness, a population-based interventional study. So all pregnant women within a defined geographic region or from a specific healthcare system are eligible to participate in the study. And the intervention is that a prenatal education program is designed and implemented targeting key topics related to maternal health, childbirth, and newborn care. So there's always an element of randomization in interventional studies. And so these are analytical studies, and in randomization, you compared one group who has received the intervention with another group who has not received the intervention. And so this is a good study design for finding out with less amount of bias whether the intervention has any positive effect or not. Last of all, we will talk briefly about Mendelian randomization studies. These are not very commonly spoken about terminologies, and so you may not have heard this word before, but this is also a type of study that can be done in populations. And in these studies, we use genetic variation as a natural experiment to evaluate the causal relationship between an exposure and a disease outcome. An example is that supposing you have a group of patients who have gestational diabetes, and you want to see the relationship between the maternal body mass index and the gestational diabetes, and you want to do this on a population-based plan. So the results may provide evidence on the causal relationship between maternal BMI and the risk of GDM using a Mendelian randomization approach. The findings contribute to the understanding of the etiology of GDM and informing preventive strategies and interventions targeting maternal BMI as a potential modifiable risk factor. Now we will move on and talk about research studies that are performed in patients who come to hospitals and who come to clinics. So by understanding the different types of these studies, physicians can design and conduct rigorous research studies that can provide valuable insights into the risk factors and the health outcomes of different diseases in populations in the clinical practice setting. So again, we have cohort studies which follow a group of individuals, which means a cohort over time, and compare the incidence of disease in those with a particular risk factor to those without the risk factor. In clinical practice, cohort studies can be used to monitor patient outcomes over time, evaluate the effectiveness of different treatments or interventions, or monitor the impact of change in healthcare policies or practices. So not only can you plan a study to see the results of treatment, but you can also plan a study to see whether if you change the way that you deal with patients or the way you treat patients or the process through which the patient goes in a hospital or in a clinic, even that can be studied through research methodologies. So this is an example of a hospital-based cohort study. And in this study, the the cohort was established. So this is important to understand how the cohort is established by identifying women who were diagnosed with endometriosis, and the inclusion criteria involved a gold standard diagnostic process, i.e. a histopathological confirmation of endometriosis, and it was over a defined study period, and the results present the long-term outcomes of women with endometriosis, including reproductive outcomes, quality of life measures, and the risk of developing comorbidities. The results provide insights into the natural history of endometriosis and its impact on women's health, facilitating improved management strategies and patient counseling. So these kind of studies require a lot of patience, a lot of very detailed planning, and a huge team of people with different levels of expertise who can be involved to study this cohort of patients. And therefore, this is one of the more expensive ways to conduct research. Cross-sectional studies can also be done, and this is the one that most residents do during the residency programs because it measures the prevalence of disease and risk factors at one point in time in a defined population. In clinical practice, cross-sectional studies can be used to identify the distribution of particular disease or risk factor in a population, or to identify factors associated with a particular disease that may be amenable to intervention. This is an example of a cross-sectional study in which postpartum depression among women in a hospital setting has been studied, and the researchers have tried to look at the prevalence of the problem in that population, as well as the factors associated with postpartum depression. So for those of you who would like to read through this entire page, we'll have to then stop the play button, and then you can read through it, because I am only going to touch on some very basic points. So the results here may show that what is the prevalence. So for example, only 3% of the patients have this disease, or 1%, or something like that. And it will also show the risk factors. So for example, maybe only the women who are in their first pregnancy will have this problem, or maybe women who are living in a nuclear family system. That means only the husband and the wife are living together and they have no family support. They may have more postpartum depression. Or maybe women who have had a past history of depression will be prone to postpartum depression. Or maybe women who are studying in university and have also become pregnant, maybe they are the ones. So the potential risk factors can be studied, and this will help to facilitate early identification of patients, interventions, and support for women experiencing postpartum depression in a hospital setting. Another way to do research in hospitals and clinics is case control studies. And in this, you identify a group of individuals with a disease and a control group without the disease. The study compares the prevalence of a particular exposure or risk factor between the case and the controls. In clinical practice, case control studies can be used to identify risk factors for a particular disease or to evaluate the effectiveness of a particular treatment or intervention. So intervention studies or intervention trials are one of the most valuable and one of the most important ways of doing research. And here the effectiveness of a new method of treatment or some other intervention is then seen to how it can prevent or reduce the risk of a particular disease. In clinical practice, intervention can be used to evaluate the effectiveness. So this is an example of a study in which the intervention has been done, and the intervention here is the preconception counseling program on folic acid supplementation. So the intervention is preconception counseling. So here a particular clinic has been chosen, and the patients have been selected through randomization. This is very important because this makes it a valuable study, because they are patients are randomized and they are then put into two groups. You either have an intervention group or you have a control group. So it's a randomized study, it's a controlled study, and subsequently the results will show us the effectiveness of the preconception counseling program in promoting folic acid supplementation among women of reproductive age attending the OBGYN clinic. The findings will demonstrate the impact of intervention on folic acid supplementation rates, knowledge improvement, and adherence to recommendation. This evidence supports the integration of similar counseling programs in routine OBGYN care to improve preconception health and outcomes. So a meta-analysis is a study in which we don't actually use patients either in clinics or in hospitals or in populations, but rather the study is conducted by looking at data and looking at studies and collecting them and then doing an analysis on the data of these studies. So it's a research methodology that has evolved over time, and scientists have evolved this method of looking at data and making meaning out of large data sets from different studies. So basically, in the context of OBGYN, meta-analysis is used to evaluate the results of multiple studies on a particular intervention or treatment or risk factor with a goal of summarizing the overall evidence on this topic. It helps us to make informed clinical decisions, helps us to analyze and interpret multiple studies over time, increases the statistical power, and reduces the risk of overestimation or underestimation of the effect of a particular intervention, treatment, or risk factor. So then it becomes a very powerful tool, especially to generate medical evidence on the basis of which we can plan treatments and we can give patients treatments which are safe and which are found to be effective. So this is an example of a meta-analysis which has been done on labor induction in post-term pregnancies. And so where some very special methodologies are used, pooled effect sizes are seen by risk ratios, mean difference, and other very special appropriate statistical methods are used, for example, Mantle, Hensel, or inverse variance method. So these are very specialized statistical terminologies which can be done by statisticians who are trained in doing these kind of specialized statistical programming and statistical derivation to find out the results. So this is an example provided to illustrate the structure and the components of a meta-analysis. In a real meta-analysis, the results will be based on a specific research question, inclusion criteria, research strategy, and statistical methods would be tailored to address a particular aspect of OBGYN practice and utilize relevant studies available in the literature. We now come to the last slide in our presentation, and basically how do we present the results in a meta-analysis. So the results are also done in a very specific way, and the results are typically presented in a systematic and organized manner to provide a comprehensive overview of the findings. Here are some common ways in which the results of a meta-analysis are shown. These are not all the ways, but some common ways. A forest plot is one way to present the results of meta-analysis. It is a graphical presentation of the individual study's results and the combined effect estimate pooled effect size of the meta-analysis. Each study is represented by a square or by a diamond, and the size of the square reflects the weight of the study in the meta-analysis, usually based on sample size or precision. The horizontal line through each square represents the confidence interval of the study's effect size. The overall effect estimate is represented by a diamond at the bottom of the plot along with its confidence interval. A summary table is usually provided summarizing key characteristics of the included studies, such as study author, publication year, etc. And this table allows the readers to quickly grasp important information about each study and facilitates comparisons across studies. So it's very important that when such studies are being done, that the studies should be presented in such a way that the results become clear, transparent, and are accompanied by appropriate statistical measures to aid in the interpretation and understanding of the findings. With this, we come to the end of the video. Please press the like button, subscribe, share, comment, and press the bell icon so that other presentations, videos, as they are released, you will get information about them. I request you to kindly subscribe to this channel to allow this channel to remain alive and viable, and to allow the presenter to continue to present topics of interest for OBGYN trainees and specialists.